Hey, it's Glenn here from Mehab, the world's leading physical therapy alternative, where we educate and empower you to take control of your recovery. In this video, we're going to share some McKenzie force progressions of the back exercises from our first video, which is linked in the description below. Be sure to check that out first before attempting any of these. If you haven't subscribed to our channel, make sure you do that now. And if you're not following us on Instagram, Twitter, and Facebook, make sure you do that as well. We provide quick tips, tricks, and facts there, and also a little motivation and inspiration for those days when you need it. Before we get started, remember our videos are for educational and demonstration purposes only. With that out of the way, let's get into it. It's important with any injury, especially back pain and sciatica, to gradually progress forces. Progressing in a controlled and incremental fashion is much safer. Often people and providers will jump too many steps or force levels ahead without understanding how the body is tolerating the low level first. Occasionally people will try the low level exercises and experience no relief. They will then stop them, mistakenly coming to the conclusion that they just don't work for them, but as you will soon see, that is not always the case. If you think of the scale of forces from 1 to 10, with 10 being the highest, it is much safer to proceed 1 degree of force at a time. For example, 1, 2, 3, 4, 5, versus making large jumps in force levels such as 1, 5, 10. Generally, if a movement is going to have a negative effect, you will start to see some indications earlier on at a lower force level. It's much easier to calm down a slight irritation than a major re-injury. Going slowly allows you to assess your response and adjust as necessary. What if a force level of 2 is enough to fix the problem and stop pain? Why would you need to go any higher? What if a level of 5 was too much and could cause re-injury? By slowly progressing, you should start to see an indication earlier at a level of say 3 and 4 in our numbers example. This would stop you from reaching that level 5 that, again within our example, would cause injury. Another advantage is that low-level forces can usually be handled by individuals themselves, meaning they can do it at home and do not need a therapist to be present. The exercises in this video are demonstrations of exercise progressions. Positive responses would be decreasing pain in general, decreasing or centralizing leg symptoms, meaning they're moving up out of the leg into the back, and increasing back range of motion. Remember, you're assessing your response to this motion, nothing more. You are looking for a definitive answer to are these making you better, worse, or have no effect. It could take 10 to 80 repetitions before you get a definitive indication of what is happening. This could also require doing them for a couple of days before getting an answer. They could initially seem to aggravate your symptoms, but improve after doing them for a day or so. If symptoms don't settle down within a reasonable amount of time after trying them, they may not be the right exercise for you. If you settle down fairly quickly and go back to your baseline pain levels, you should probably try them again. If you're finding you are not tolerating the exercise, you could either try a lower level exercise or try doing fewer reps of the exercise. Think of it like a traffic light: red, green, and yellow, or orange depending on where you come from. An example of green would be you do the exercise and symptoms stop, decrease, or move up out of the leg. A red light would be symptoms get much worse. Worse being increased pain that does not fade fairly quickly, does not return to baseline levels, symptoms move further down the leg, or loss of muscle strength or control. Orange or yellow light would be something like you had an increase in symptoms but they returned to baseline quickly and you're no worse. That would be an indication to proceed with special attention to what is happening to your symptoms before saying, yeah, nah, this is not for me. On to the exercise progressions. The first force progression beyond our original video's exercise is extension with exhalation. Laying on your table, place your hands directly under your shoulders. Relax your back, hips, and legs, and press up, straightening your arms. Try and relax, keeping your hips on the table. Once all the way up, take a breath and exhale, lowering your hips to drop further into the table. Make sure your elbows stay locked out, as many people will start to bend their elbows when they exhale. Pause for a few seconds, then slowly come all the way down. Rest a few more seconds and then repeat. You can experience some increased back pressure or pain, but it should fade away in the rest position. Remember, the initial few may temporarily increase symptoms, but you're looking for an overall effect and not just the result of a few repetitions. Extension with a lift. The next progression requires yoga blocks, some books, or pieces of wood. We are looking for end-range spine movement. Typically when approaching end range, people will struggle to lock out their elbows, and it does not get any easier with multiple repetitions. You will hear some people say that it's bad to extend your spine this far, but it's just not true. These forces are low and progress gradually. Your spine is not going to break or explode from this activity. People who experience no resistance or difficulty in getting their arms to lock out while keeping their hips down are essentially running out of arm length before they run out of spine range of motion. By adding blocks under the hands, we can artificially lengthen the arms. The exercise is essentially the same as the previous one, but we do not recommend exhaling at the top initially, as we're already progressing forces by adding blocks. Place the blocks under your shoulders and place your hands on top. Relax your back, hips and legs, and press up, straightening your arms. Try and relax keeping your hips on the table. It may take several repetitions before you're able to fully straighten your arms, and in some cases people may not be able to get them fully straight even after many attempts, and that's okay. If you are able to lock out and you're tolerating that motion or seeing improved symptoms, you can try adding the exhale portion of the previous exercise. Press up, exhale at the top, letting your hips sink into the table. Make sure your elbows stay locked. Pause for a second or two and then come down. If you're getting some relief but not complete relief, there are a couple of things you can do. The first and likely best suggestion is to stay with the least forceful exercise that seems to make symptoms better. Stick with it for a few days and perform it every couple of hours that you're awake. If that does not abolish all your symptoms, you can move to the next force progressions. Extension with Self Overpressure. You'll see other videos using a sheet or strap placed over your lower back to hold your hips down and give overpressure. That is a complete waste of time. It does not hold your hips down nor give overpressure. If you have tried it, you will know all it does is slide up your back. If you really want to see how to do this yourself, let me know in the comments below and I'll show you how to do this correctly if you have no one available to help you. It's an awkward setup and difficult enough to do when you're not in pain, and it would be better to pick one of the other exercises. Extension with Assisted Overpressure. Depending upon what surface you're on will determine the technique that you use. Option 1. If you're on an elevated surface like a coffee table, a kitchen table, or an exercise bench, you can have someone place their hands on your low back and apply some pressure as you do the press-ups. You want to have them provide pressure, but also allow you to perform the exercise, and follow you up as you move. Do not be afraid to try this. The chances of causing any serious problems or doing it wrong are very low. Hand placement is not a huge deal, just have your hands around the waist level on the low back. Option 2 is to use a sheet or strap and anchor your hips down. This exercise requires another set of hands and is one of the highest force progressions. This is a much harder progression as the strap does not move. You may have to play with the tightness to make sure that the exercise is challenging but still doable. Another option is, if you do not have a table, is to do the exercise on the floor. This is not a good option for someone in high pain levels and sensitivity to bending or flexion. It can be very hard to get up off the floor. If it was me, I would pick one of the exercise options. However, for the purposes of demonstration, we will show it. Take a sheet or a bath towel and fold it so it's about 4 inches wide and lay it over the lower back. Have someone stand over you on the towel with their feet, 1 foot on either side of you. Their body weight will add the pressure needed to help keep the hips down. Again, keeping the hips completely on the ground is not essential, just do the best you can. Have someone help you off the floor if you do try this one. So there we go, a demonstration of the advanced extension progressions that may help sciatica and low back pain. Remember, choose the easiest exercise that improves your symptoms, either from video 1 or from this one. More force is not always better. If this was helpful, please hit that like button. Be sure to subscribe and click the notifications bell so you don't miss out on any of our upcoming videos. Thanks again, and we'll catch you on the next one.